So, welcome back, healthy people, to another episode of On Call with Dr. Randy. Today we have Bryan, Texas own PV graduate, aka Dr. Tranika Jefferson. Welcome to the podcast.
Hey, woo woo. Thank you for having me.
I appreciate you being on. So, this month is Autism Awareness Month. So, I wanted to have Dr. Jefferson on to talk about autism. But before we get into the nitty gritty of it, tell us a little bit about your educational background.
Okay, so as you stated, went to Prairie View. My didn't really know what I wanted to be when I got to college. I just knew I was going. So my bachelor's degree is in criminal justice, specializing in juvenile justice. So I knew for sure that I wanted to work with kids in some type of capacity. After that, I graduated in 2006 with my bachelor's. I wanted to keep the party going, so I stayed at PV, got my master's in juvenile forensic psychology. So at that point, I thought I was going to be a forensic psychologist. Graduated with my master's in 2009, and from there, that's when I got into the work field and I started working. So the first job that was offered to me was doing applied behavior analysis therapy, working for the state. And so I had no idea what that was. I just knew I needed a job to start paying bills and knocking down the student loans. And so the first thing that they told me was that, oh, you may want to use applied behavior analysis therapy to work with your clients, because they gave me basically the toughest unit to
Hmm.
provide therapy to. And so with that, they offered to pay for postgraduate courses in applied behavior analysis. So I'm like, okay, bet, free education. And so from there, I took postgraduate courses through the University of North Texas. And so I did that for 2 years until I completed the postgraduate coursework, and then I tested with the Behavior Analysis Certification Board. And so I did practicum hours, and then I passed in 2014. And so from there, I became a board certified behavior analyst. Once Texas gave behavior analysis licensure in 2018, I became a licensed behavior analyst for the state of Texas. So I worked for a few years, and then in 2017, I was still kind of battling if I wanted to do forensic psychology as far as a doctorate program, or if I wanted to stay in the field of applied behavior analysis. So by this time, I had been working in the field of applied behavior analysis since 2009, and I fell in love with it. So I decided to just to stick with it, because I couldn't see myself doing the traditional type of therapy and someone coming to talk to me and telling me their problems. I figured like that wasn't for me. And so I got my doctorate in applied behavior analysis in 2021, and it's been up since. And so I'm a doctorate level board certified behavior analyst. So that's my doctoral journey.
Okay, that's what's up. You kind of sound like me a little bit as far as undergrad at PV and sticking around and get your master's. It's like, man, I'm not ready to go. It's so much fun on the yard.
Right?
So, what made it so special for you as far as focusing or your interest in behavior analysis?
So when I started doing it, I had no idea what it was. And so it was more of a hands on approach as far as changing human behavior. It was more objective for me. So um, the type of therapy that we do is changing behavior in a sense that where we're manipulating the environment. So it's not just sitting talking to someone, because everyone that I work with, half of them don't have vocal language. And so once I got a chance to actually see physically the interventions that I was doing with them and their behavior change, such as if it was a kid that I'm teaching communication skills to, and they've never said their mom name before, and now they could actually say mom. Like that's life changing for me. Like that's where I grew my passion with actually wanting to stay in my field and loving what I do. Or if they were never able to like sign juice before because they love grape juice, but now they can, and that actually helps them be more independent. Or if a kid that they're 12 years old and they've never learned how to independently use a restroom before, and now they could go into the restroom and use it on their own. So things like that, as far as like I could actually see like what I'm doing that is working. And they may not be completely independent 100%, but they're better off than before they started therapy.
And part of your background training was focused in autism?
It was not. So the field of applied behavior analysis is heavy weighted on working with kids with autism. That's where a lot of jobs for ABA therapy comes from. A lot of the grant funding comes from working with kids with autism. But my training, I did my dissertation and a thesis basically with performance management. So when you think about behavior analysis, it's basically everything in life that is alive that I could do applied behavior analysis therapy with. So I did performance management, so part of improving staff performance, at their job. So I could really do applied behavior analysis with anybody. I've done it with boyfriends, I could do it with family members, I could do it with dogs. So it really doesn't matter. It's just the funding sources are typically with kids with autism. But I started out working my first 8 to 9 years in my field. I worked with adults, and all of them did not have an autism diagnosis. They were duly diagnosed either with an intellectual disability or some other mental illness.
Okay, so let's go into autism because I am not trying to get analyzed today. So we're going to focus on the
Exactly.
autism.
Give you
So
an
if,
invoice later.
oh man, Lord Jesus. So let's talk about autism. So the common person, a layperson who may be listening, has heard of autism, but they don't know the exact definition of what autism is. So how would you explain it to someone?
So autism, a lot of people have their assumptions or things that they read or heard about, how people get autism. But the facts are it's a genetic, disorder, and it's also influenced by different environmental factors as well. So basically, it has to do with brain development. So it's very complex. So typically, a person with autism, you'll see deficits in their social communication skills, their interaction skills. You'll see deficits in them, like repeating things over and over, or repetitive things such as like lining up objects in a manner that shouldn't be lined up. Also, some of them may have some excesses in maladaptive behavior. So they may have tantrums, they may cry, they may have aggression, self injury, non-compliance, any type of behavior that's problematic. You may see that in a person that has autism as well. But more so, definitely deficits in the um, social skills, communication skills, and also those repetitive behaviors or interests in items and things like that.
So
But
what
it
have been
varies. Like autism doesn't look one way.
yeah. So what have been some of the common myths that people have told you that they think that their kid have gotten autism from? Because I know one of the common ones for me as a healthcare provider is like the vaccines. That's what's causing kids to get autism.
Yeah, that's the number one that I hear is the childhood vaccinations is what has caused their child or other children to have autism.
Mhm. So are there like what are the early presenting signs for a kid having autism?
It really varies by individual. If the person is, for example, if you have a typical developing kid, and then you have another kid, and if you're comparing, like, okay, if your other child, their developmental was basically on track with other typical developing kids, but now you have another kid, and you notice that their developmental milestones are delayed. Really, the most of the time, the parent like knows like that there's something that is off track with their kid. They may not initially be able to pinpoint it. But some of the initial milestones, like if they're not making joyful facial expressions or smiling by 6 months, that's one of the signs. Or by 9 months, if they're not imitating sounds that other people are making or babbling, goo goo gaga, by 12 months, that may be an early warning sign. Or if they're not imitating like gestures. So if you're pointing to different objects and they don't point to different objects, that may be an early warning sign as well. Or by 16 months, if they have no vocal language at all, that may be a sign. Or if you're trying to make back and forth communication with them and they don't do back and forth communication, or if they don't use like 2 word phrases, things like that, by 24 months. Or at any given point of their life, if they have regression in like social communication skills, or if they used to babble and now they don't babble anymore, that may be an early warning sign, but it may look different by the kid.
Mhm. So what I always kind of like to do in these type of conversations that I have is just kind of give an example, a case scenario, and what parents should do, because there may be someone who's out there listening now and their child is going through this right now. So let's just say there's a kid, their parent noticing they're not meeting their milestones. They're about 1 year old. They're not babbling. They're not crawling as much. What early intervention should that parent do as far as take their kid to a pediatrician, come see you? What should they do?
Yeah, well, they'll have to initially go to their primary care physician and let their primary care physician, know that they've noticed some delays in their kids' developmental milestones and request that their physician do just a general developmental screening and also an autism specific screening. And from there, if they're PCP, if from that, the screening, if they indicate deficits in any areas just as the screening, then that PCP can recommend a more in-depth evaluation be conducted by either a neurologist, a psychologist, or a pediatrician. And once that pediatrician does the full in-depth evaluation, then depending on the deficits that came out of that evaluation, then they can refer to other specialized therapists. So if there were deficits in communication, they could see a speech therapist. If there were deficits in in their speech, language, or hearing, they could see an audiologist. Any deficits in their movement or sensory, they could see a physical therapist or occupational therapist. If they had deficits in nonverbal or verbal abilities, they could see a psychologist. And then if they had more issues as it relates to problematic behavior, as I discussed before, they could see someone like me, a behavior analyst. So, or they may see a combination of all of these, specialized therapists. Typically, the kids that have autism that I see, they see me, the behavior analyst, and they also see PT and OT. So it all depends on what actually they need to work on.
Okay. How important is it to get that early intervention?
It's like the most important thing. One of my pet peeves is hearing other people that, they may be in denial about their kid, having an autism diagnosis, or they suspect it, but they don't want it to be reality where they actually get that confirmation that their kid has an autism diagnosis. Basically, what it does is like you're doing your kid a disservice if you don't get early intervention. The chances of them being more successful and being, independent and whatever skills that they need to learn or problem behavior that needs to be reduced is better for it to start at an early age, as opposed to, parent being in denial or don't have access to services, because sometimes that happens. And, the kid end up, growing up, now they're a teenager, now they're adult. We've all heard of those instances in the news where, autism kid got lost. They never learned safety skills, or they end up getting shot because they didn't know that they couldn't fight the police officer. So issues like that is like you really are doing them a disservice if you even initially just get it ruled out, because it may be simple things that they could work on, or maybe more complex things or problematic behavior that needs to be addressed. So early intervention is the number one thing that the parent could do once they get that autism diagnosis.
How tough is those conversations for you as a provider, kind of talking to those parents and letting them know about their child, like, hey, this is kind of what's going on, and trying to ease their concerns and let them know that you're trying to help them out?
So by the time they get to me, they've already gotten the autism diagnosis. So they've already gotten that from their medical profession. So when they get to me, they're more so focused on how can you fix my child? They're wanting the immediate quick fix. And it's like, well, with most therapies, there's no quick, turnaround. So it's having those hard conversations as far as like, this is the process. And this may be a process that they have to, go through with the rest of their lives. Maybe, maybe not. We don't know, because everybody responds to, therapy differently. And also getting them to understand that, we all have to be on the same page. Everything has to be consistent. Like you can't drop them off at therapy with me and I train you on what to do with the kid at home and then you don't do it. It's like, these skills have to generalize to other settings in order for your kid to be as successful as possible with doing this type of therapy. Also letting them understand, like, okay, well, you want your kid doesn't speak, any vocal language right now at all. Your expectations have to be realistic. Because I've had parents ask me, like, okay, well, they're starting therapy with you. Will they be talking by next month? And I'm like, I can't promise you anything. I can promise that I'm going to give you evidence-based treatment, and we're going to, do our best as possible. But I can't say that your kid is going to be talking next month when they can't even babble right now. So letting them understand, like, the consistency and having realistic expectations out of the treatment that their kid is getting.
So what's the average age that a kid comes to see you by?
3.
Okay.
So the screening process, um, initially, a lot of parents may notice things that, may be quote unquote off with their kids around 6 to 12 months, or sometimes even sooner. May notice some signs of autism. They can start screening at about 1 year, 1 years old, and then at 2 years they could actually get a diagnosis. By the time they see me, the earliest they could see me as far as what insurance will pay for, unless a parent wants to pay out of pocket, which is fine. I accept all money. But insurance will pay out at age 3.
Okay, so let's just say a kid comes to see you age 3, initial visit. So how does that go for the parent, and how does that go for the child and you assessing them on their initial visit?
Okay. So I think I just ran into initially talking about applied behavior analysis therapy, but I didn't explain exactly what that is. So typically in our world, we are either trying to reduce any type of problematic behavior, or we're trying to increase some type of adaptive or skill that they should know for their age range. So sometimes the kid may not have, problem behavior that needs to be addressed, but they need to learn how to independently use the restroom, or fine motor skills like tying their shoes or buttoning their clothes, or doing household chores, making their bed, washing dishes, things that will make them more independent. So it all depends on where they're currently at. So in my field, we initially do like verbal, language, social assessments to figure out what the starting point for this particular person is. And based off of the deficits that we find in those assessments, that's basically our starting point, whether it's social play skills, communication, adaptive skills, whatever that may be. And then we program from there. Now, if it's problematic behavior that we're addressing, so for example, if a kid, has physical aggression, they beating up everybody in the household, what we initially do is called a functional analysis. So that functional analysis or functional behavior assessment is going to tell me the why. And with all of us, we all do something for a particular reason. And so we break it down into specific categories. Whatever behavior that you're doing, you're either doing it for attention, you're doing it to escape or avoid different situations, people, environments. You're doing it just because it feels good to you, or you're doing it to gain access to something. Once I figure out that why, then I do behavior programming to teach you how you can get this why more appropriately. So if you hitting your little sister so you could get mama attention, I'm going to teach you a more appropriate way to get your mama attention. Or if you having a tantrum because you want your iPad, then I'm going to teach you how to request the iPad more appropriately, other than, having the problematic behavior. So initially we start out with different assessments, whether it's skill or behavior assessments, and then move on to the programming that we're actually going to implement with that particular person.
Okay, so let's kind of
And I
stay
think
on
I
this. Oh, you got one more?
No, I was trying to make sure I answered your specific question that you asked me, because I may go down a rabbit hole sometime.
No. You did a good job. You did a good job. So just kind of trying to go on the same track as far as, let's just say, using the aggressive child. How do you build up a bond between you and that child and trying to help them? Because at first, like, you're a stranger and you're trying to help them deal with their aggression.
hmm Yeah, so I never initially start therapy and tell them what to do or place demands on them. I come in like I'm gonna be your best friend. I build rapport with them. I'm playing whatever they like to play with. I'm playing with it too. Like, you like to play with Legos, you like to play with toy trucks. Okay, I'm laying here on this floor and I'm playing toy trucks with you. Or you on your iPad, whatever it is that from assessments that I found out that's reinforcing for you or your preferred items or activities, I'm doing that with you. So you don't see me as an aversive person. Like, okay, this lady came in and just started telling me what to do. I'm about to fight her too. So it's like my at least two, three initial sessions that I had with that person. I'm not going to say kid because I've worked with adults as well. Is building that rapport, but it's not just with the actual client. I perceive the parent or the caregivers or whoever else is in that household to be my clients as well. Because a lot of it is the buy-in from the parent. I can't expect them to do the programming that I'm teaching, their child, and they don't like me. So I try to build that relationship with the parents as well so they could trust me. And then they're more likely to, do what, okay, well, Dr. J did say to do this and don't do this. And, I like her, so I'm gonna do what she say. So things like that. It's like getting that buy-in from anyone in the household because I bring in the other siblings into the sessions as well, depending on what exactly needs to be worked on. If
Mhm.
daddy ain't at home, I was like, okay, well let's get daddy on Zoom because he needs to be here too. So situations like that is like I need everyone involved because ultimately when I'm out of the picture, y'all need to continue to run programming as if I'm not here at all.
All right. So how often, I know it kind of varies by case, just like physical therapy, somebody going in for back pain issues, but how often does a client come in to see you? Is this something weekly or they come once a month?
It really varies. So we're talking about from insurance billing component. It
Mm-hmm.
depends on the level of need of the client, the medical necessity. So some kids that may be a level 3 as it relates to the autism levels, they may need, of course, a lot more support because their autism is more severe. They may not have any vocal verbal language. They may not interact with other people. They may have very problematic behavior. They may be very sensitive to crowds and noise, have different physical ailments, things like that. So the insurance company may approve 40 hours of ABA therapy for this kid. But for example, if they're level 1, which is, less severe, more the higher functioning individuals that may have just more so social deficits and lack communication skills. They may talk, but they may not know how to initiate or maintain communication with someone. They may not be as organized with planning and different things like that. They're not going to need 40 hours of ABA therapy in a week. They may only need 10 or 5. And then also some organizations or businesses, for example, they may only do focused ABA. So, for example, for my current job, I run a clinic underneath Harris County. My clients there only see once a week for 1 hour. That's because, like, I ask parents, what's the most important thing that you want your kid to learn or to not do right now? Like, okay, well, most important thing, like they have self-injury, they're head banging. And so like, okay, we're gonna focus just on that because I'm only giving you 1 hour a week. So it's
Mm-hmm.
not like private practices where the kid, we're billing insurances and they may get 40 hours, out of the week because their autism is more severe. So it varies by insurance and then the type of program that your kid is admitted in. If it's focused or if it's more comprehensive. Comprehensive, you're going to get more hours. Focus, we're focusing on the exact need at the moment that will make this kid more independent, reduce harm to either themselves or other people.
Now, I'm glad you brought up the insurance issue because I always like to give like my listeners a peek behind the curtain and let them know some of the things that we deal with on our side. So, are there any times where you feel like you have to fight the insurance on behalf of your patients because you feel like
Oh
they
Lord.
need more time and they're like, nah, we feel like based upon our criteria, they only need 20 hours.
Yeah, being a mental health professional in general, like if you're really passionate about what you're doing and you're really trying to help people and you not just doing it to, get the bag or whatever to pass by time, you're an advocate for your clients. If I know my client need 40 hours, I'm calling the insurance company like, every day, multiple times out of the day. I got them on both of my phones on hold because I want my client to have the best services. Because of their level of need. It's like they're not going to benefit from 1 hour of therapy once a week because their behaviors are too severe. Their skills, they lack a lot of communication skills. They can't do X, Y, Z. They need more than that. So you definitely have to be an advocate, specifically working with kids, with autism or any type of special needs. Even with my own practice, I tell the parents of their kids, I was like, do you need me to go to the school with you? Like, I'll sit in the art meetings. It's like, I will advocate for you because they need services inside the school as well.
So you kind of mentioned it earlier, talking about having all the family members involved in the treatment plan. So what are the things that you give the parents to work on when they go home, like the homework for them?
Well, it varies by whatever skill or behavior that's being addressed for that kid. So, one of the things that we do with applied behavior analysis therapy is parent training. So every 2 weeks or once a month, I'm either, doing on, HIPAA Zoom, training that parent. It could be on that kid's actual program that we're working on with the kid, or it could just be on basic behavior analysis principles in general. Like, I'm teaching you how to do positive reinforcement and rewarding your kid in the correct way. I'm teaching you how to prompt your kid with using a prompt hierarchy, things like that. So the work that they're given, it could of course vary by whatever skill deficit or behavior that I have them working on with the kid. But yeah, they get homework. And so I like to make sure that whatever I'm teaching, that the parent knows exactly how to do it. So, I'm testing their competency. Is like, okay, I'm going to do this and then I'm going to watch you do it, just to make
Mhm,
sure that they're doing the program, as written, that treatment integrity component of it.
mhm. And so this might be seeming like a simple question, but how do you know if they do their homework? Are there certain things that you're looking for when that client returns to see if they met those milestones or regressed in some kind of fashion?
Yeah, so one of the main things I could tell is if I'm working on a particular skill with a client, and say I'm only seeing this client like once a week for an hour. I've trained the parent on how to do the programming, and this kid continues to basically, master and progress in this particular goal. It's like, I know the parent, like, I know you're working on, shoe time with your kid, how I asked you to, like, at least, 3 times out the week for 30 minutes, like, work on this skill with them. That's like a telltale sign, because like, oh, the next session they knocking it out, they the progress from step 3 to step 11 since the last time I seen them. It's like, okay, I know mama is working on this with them at home, as opposed to some parents aren't as adamant with implementing skills on their own. And like, if I see that regression, or sometimes the parents tell me, they're like, well, I just don't have time.
Hmm.
And, if I, for example, I worked with triplets before. All three triplets had an autism diagnosis. And what I was working on with them was them being more independent with using the restroom. But the only thing that they really needed to progress in was wiping themselves independently. So they would come to my clinic, and basically they mastered wiping themselves in my clinic. I didn't have my staff, we didn't have to do anything. They would go in there, do what they got to do. They ran their program on their own. When I would do parent training with moms, like, okay, well, how's it going, at home? And she was like, oh, well, I'm still wiping them. And I'm like, why? It's like, you sent them to me for a particular reason, to learn a particular skill. They learned it, but it doesn't matter if you're not implementing the same skills at home. They're only at my clinic X amount of time, X amount of days out the week, and they're going to be discharged soon. Like, this isn't a long term program. So, what really matters is what you're doing at home. It doesn't matter, the skills that they're learning here, if you're going to do it for them.
Right, right. So you kind of mentioned earlier talking about kids having to see all kind of different specialists. So they're seeing PT, they're seeing speech therapy, they're seeing you. Like, do you coordinate care as far as y'all talking to each other and seeing what kind of milestones that they're not reaching?
Yeah, so typically what I do is, at the initial intake meeting that I have with the parent regarding therapy services for the kid, I ask the parent, what other specialized therapies is the kid seeing? Just because I don't want to do anything that's contraindicated with what the speech therapist is doing, because I teach, language and communication as well. And so it's like, for us to be on the same page with each other, it's like, okay, well, they're teaching, them to communicate with using picture communication exchange systems, or picture cards, or with pointing or gesturing. I want to make sure that we're not doing anything that's going to negatively affect each other's therapy. And so
Mhm.
I had those conversations with them, like, can you send me the treatment plan that you're working on? And a lot of times they may reach out to me because the kid may have problem behavior doing OT sessions. And so they're like, hey, Dr. J, like, how do you intervene, when they fall out to the ground and have a tantrum and they're kicking and screaming? Like, what do you do in your sessions? And so I'm like, okay, great. Like, I actually be a part of other specialized therapy. So that's the great thing about working in a team of people. So a lot of times with different jobs, I work in an interdisciplinary or multidisciplinary team where we get all kind of feed off each other. Like, okay, well, what are you doing and how are you addressing this? Or I may use different type of edible reinforcers in my programming, but it's like, okay, well, I need to talk to the nutritionist because maybe they can't, eat M&Ms, or maybe the texture is they on a puree diet and I don't even know that. So it's very important as far as my profession, when we're working with kids with autism or any type of developmental disability or special needs, that we kind of consult with all other specialized therapies just to make sure that we're on the same page, and we're not doing anything that's going to be detrimental to another specialized therapist with them progressing in that therapy as well. And of course, like, to help out, like, okay, I'm always in the mix of the other therapies because a lot of times my clients have behavioral issues that need to be addressed just so that therapy can be successful, because a lot of times they can't get past certain goals because they didn't had a tantrum for the whole hour while they was with the speech therapist, and
Mm.
she isn't trained in behavior analysis, so she could intervene, but like she don't know what's maintaining the behavior, she don't know the consequences and um, the different interventions that we're using to decrease that behavior and the skills that we're teaching, so they could gain access to what they want to more appropriately.
Yeah. So you talked about like PT, OT, speech therapy, you meeting with them. So what's kind of your game plan, or how do you interact with kids who are actually in school? How do you help them with their schooling and working with I know you mentioned ARD meetings earlier. Some people may not know what those are, but I mean, you can break it down for them. But how do you work with the schools?
Yeah, so when I mentioned art, I don't know, that may be a Texas specific thing, but basically, if your kid is in special education classes, um, at least on a yearly basis or as needed, because the parent can request them as well, is when the teachers, maybe the paraprofessionals, the parents, whoever else is providing services in the school for the kid, they have a meeting for the kid to go over programming, or kind of like on an as needed basis. So, like, okay, well, now we need to implement some type of behavior support because now they're having behavior issues, and to review different goals and the treatment plan for the kid inside of the school. Um, you asked, where
Hmm.
do I come in as it relates to the school?
Right.
So with my current job, we can't cross over into the school system because there are special education laws where the school is supposed to provide behavioral support. However, sometimes it's not always done or done in the most effective manner, depending, on the school, on the school district, how much advocacy the kid and the parents have. But we aren't allowed to cross over to that. Now, for my own business, me and my staff, we go inside the school district and we do ABA therapy in the school with the kids. So we may pull them out and take them to the library or to the hallway or to some area where, of course, their dignity is still maintained, and it's not like, oh my God, like this Billy is getting therapy. So we pull them to
Hmm.
the side and we still do therapy with them inside of the school district, depending on, again, the skills that they need to learn, because sometimes it's social skills, um, and they may not have any siblings at home, so it's like, how am I really going to work on like social play skills if they don't have anyone at home that I could actually practice it with them. And then also making sure, again, just like I've talked to OT, PT, speech therapists, is making sure that the teacher is on board as well, and she knows whatever programming that I'm doing with the kid. So as long as, of course, mom, dad signs consent, I could consult with any of these people
Hmm.
and provide
Have you
training.
Have you seen any kind of different in progression of kids as far as different financial backgrounds, different racial backgrounds? I know a lot of stuff in research kind of talks about development as far as us, as far as Black individuals. We may not be getting the best kind of support with these type of issues.
Yeah, a lot of times there isn't a lot of support, or people just don't have the knowledge for whatever reason on the services that are available. Most of my clients are the lower social economical areas. Most of them clients that I have for the county are Black and brown. Most of all of them are boys. Autism has higher rates with boys. And within the Black community, we wait longer to actually get that diagnosis. And so to go back to the initial conversation as far as early intervention, it's like, okay, we waited longer to get that diagnosis. And now, some of those behaviors that they've been doing is like they've been conditioned to do these problem behaviors, since they was 3, and like they've never gotten any type of intervention for it. And that's one of the downfalls as far as our community is like sometimes we're in denial, sometimes we don't get the treatment that we need, sometimes we may want the treatment but it's like, okay, well, I can't afford it, but I don't qualify for Medicaid, so I don't know what to do. Or with the type of therapy that I do, like we have long waiting lists, especially under my job with the county. It's like people wait 4 years to actually come to my clinic and see me and my staff. That's just how long the waiting list is. It's lots of private clinics, but if your insurance don't cover it, like we expensive. So it's like, you're dealing with a kid that has these deficits, and sometimes you want the support, but you can't get it, or you don't know where to get it, or how.
Mhm. What have you kind of seen as far as sacrifices that parents have to make for their children? So, like my previous guest, her child had autism and she's a physician, and her husband quit his job so he could help take care of her, bring her to appointments so she can reach all her milestones and have the best treatment that they can do. So, I didn't know if anything on your end that you've seen that parents have to do on a consistent basis to help their children out.
Yeah. So typically, I want to say in my career, I may have only interacted with, as far as being the primary parent, maybe 3 or 4 fathers that were involved in their kids' treatment in my whole career. And so
Hmm.
typically it's the mom that's having to make those sacrifices. So she may only work part time because their kid having to come see me and have ABA therapy. They got to go to speech. They got to go to OT. They got to go to PT. They may receive your counseling services. They may have a social worker. And so it's like our kids with autism, typically they are involved in a lot of different therapies in order to make sure that your kid gets the most effective treatment as possible, and you're trying to do as much as you can. Anything that you hear of, like, you're trying to make sure that they get. It's hard having a full-time job, like, because you're taking them to the speech over here on the north side. On the south side, you have ABA therapy, and these sessions are hours at a time. So unless you have like a good support system, it's hard trying to navigate all these different therapies, and you may have other kids. So it's like this may just be one. And then sometimes sometimes how it works is a parent may have multiple kids that have special needs. So it's like they're having to take, Sarah to her ABA therapist, and then they got to take Bobby to, speech. And it's hard with trying to juggle all those things. So it's like my heart goes out to the parents that are basically trying, because worst case scenario, I've had parents that don't try,
Hmm.
and it's heartbreaking, because, like, these resources are here available for you, and depending on if you have Medicaid or whatever funding source that is actually going to pay for it, it's like, okay, you done missed sessions, like the parent is not compliant with like implementing programming. I ain't seen your kid in 2 months. I'm about to discharge him because I have other people on my waiting list. But it's
Mhm.
like, you don't want to do that because that'll affect the kid. But it's like, but mama keep counseling, and I can fill this spot with somebody else that's going to take it and benefit from these services. So yeah, it's really hard.
Yeah, that's what I was gonna ask you. What do you do in those situations? Like you discharge them, you keep them. Like, do you have a duty to report them? Like, mom or dad's not doing what they're supposed to do. It's so many different levels right there.
Yeah, I mean, I try to work with them as much as possible because I know the stressors that they have is like, imagine, I could only imagine having a kid that has any type of special needs. And like I said, some of them have multiple kids with special needs. And then just life in general. You never know what someone, has to deal with on a daily basis, what their own struggles are, because a lot of times the clients that I have, their parents have their mental health issues as well. And so just like one thing after another could exacerbate, one issue. And it's like, this lady keep calling me about, this therapy. I'm tired. I just got off work.
Mhm.
And, baby daddy issues. It's like, you just never know. So I try to give as much grace as possible. But then I also have to think more. I'm a mental health professional, but it's also a business. So, and I need to get in. Like, if you can't be here, there's another kid that actually needs my services right now as well. So I'm going to put you on pause. Whenever, your life situation gets more stable, then, feel free to contact me back. But I can't continue to, hold your slot when it's another kid that really needs help right now as well. That may be
Mhm.
more, consistent with treatment.
All right. So, me as a family medicine physician, I deal with a lot of patients who have mental health conditions, anxiety, depression, ADHD, OCD, a whole litany of things. How do you, as a doctor, not feel overwhelmed and take all of this home?
I do self care.
Mhm.
So I try to, as much as possible, I try to leave, client issues, problems, there either at the clinic or not try to go home and still continue to think about it. But it's natural, it happens. And so I make sure that I'm supporting my own mental health stability by doing things, that I like to do that help me decompress, whether it's going to the nail shop or getting massages, enjoying nature, just taking a walk, walking around, enjoying friends, things that I like to do. And also being able to decompress with someone else. So if I have to have my own counselor, a lot of mental health professionals, you may be a licensed professional counselor, licensed clinical social worker, a clinical psychologist. One thing that we're told in grad school is you're going to need your own counselor to help you decompress. You're used to, taking on so many of other people's problems, and even unconsciously, like that weighs on you. Like I remember I would go to sleep at night. I'm still thinking about like clients' programmings and doing safety plans. And it's like, oh, like did they, try to commit suicide today? Like issues like that. It's like, why am I thinking about this? Go to sleep. And so it's like we need our own way of decompressing from the issues that we take on from other people. And there's nothing wrong with it.
I totally agree. I'd be doing the same thing, going to sleep like, did I put that order in? Or like for me, looking at labs and trying not to look at them right before I go to sleep. Because one time I looked at a lab and I saw somebody had HIV. I'm like, now I gotta call them tomorrow and tell them that they have HIV. But now I'm staying up all night thinking about that and how that conversation is gonna go. So we always gotta find ways to kind of decompress.
Yeah.
So
And I
yeah.
think another important thing is I know with my type of clients, sometimes I have to set boundaries early, like even with parents. It's like, okay,
Mhm.
well, if it's the emergency, I'm probably not the person that you need to call. Like you need to call 911 or at this point 988, or take them to the closest psychiatric hospital. But if it's an emergency, do that.
But I
Usually my
trust
business
you.
hours,
I trust you. You the coolest
my
one out
business
of all of them.
my business hours from 8 to 5 or 9 to 5, whatever I choose it to be. And I mean, that's very important when you're working directly with people. And I initially talked about building that rapport. And so it's just like, I've had parents call or fathers call, and it's like, okay, well now you're not talking about your kid, and this ain't got nothing to do with business. Like you tell them personal, like
Mhm.
you can't. I could talk to you about your kid, sir, but you aren't going to invite me to happy hour and asking where I'm going to brunch today. Like no, like I'm I'm still a professional, and that the boundaries is I don't cross it,
That's what's up. That's what's up.
and don't call me after
So,
5.
so let's talk a little bit about your business and your team. So, tell me about your practice.
So my current business that I recently started is called the Behavioral Wellness Academy. So we specifically just do applied behavior analysis therapy. So we either do it in the kids' home, we go to the schools, we do it in the community. I mean, I have clients that we may work on different skills inside the grocery store. So we may go to a HEB or to a Kroger, or we may go to the park or some of the trampoline houses, depending on, whatever skills that we have to work on. And then also we do telehealth therapy. So may get on Zoom and do therapy that way.
How important is it to have a great team to work with, especially in the mental health field?
Well, with the type of therapy I do is very important. So my team consists of I have interns, I have registered behavior technicians, which is the lowest level of the behavior analysis hierarchy, and then there's also assistant level behavior analysts, which are board certified assistant behavior analysts. They have their bachelor's level, and then the master's level is board certified behavior analyst, and then I'm the doctorate level. So typically, if you're at the master's level or, of course, the doctorate level, we're not always the one that's implementing our programs. Our registered behavior technicians, our direct workers with the clients, they're the ones that's implementing the program. I may come once a month or once every other week and supervise my staff and make sure that they're implementing the program correctly, the parents are being trained, the goals are being met, or if there are any adjustments that need to be made. So I'm not there. So it's ultimately important for the person that's directly providing those services for them to know what they're doing and do it consistently. Because I'm not an overzealous like supervisor or manager, but I'm trusting that they're doing what they're supposed to do with the client outside of someone being over watching them. So they're working basically with a lot of autonomy because they may be in a kid's, home for hours or, at the school for hours, and I'm not there. So they have to go through, of course, a lot of competency, training with me, and then I just don't hire anybody. It's like you're a reflection of me and my business. So you are going to like I only hire like the
The
the high
cream of the crop.
performers. Yes.
So as we kind of wrap up, if there is a parent out there who's listening who their child was just recently diagnosed with autism, what kind of words of wisdom would you leave them?
Autism is not a death sentence. Your kid's life is not over. They can still learn functional skills. Their behavior can still improve. They can still live, a very wholesome, successful, fruitful life. So, but the thing is, like, you have to get those, services that they need as soon as possible. Don't wait because you may be on a wait list. You may wait till the kid is 12 years old, but now you waiting 4 years for them to even be seen. So once you get past getting the diagnosis, of course, have your feelings. A lot of people have an emotional response from it. Once you get out of your feelings, then contact your local mental health authority, whoever is the early intervention office or services for your state, and go from there. But don't not do anything. That's the problem. Do
And
something.
and how would they reach out to you if they're trying to get on your wait list? How would they hit you up for services, not for brunch, but for mental health services?
Right. No brunch dates, guys. If they want to contact me, they could email me at the Behavioral Wellness Academy at gmail.com.
Okay, so I'll make sure to put that in the show description and the notes so y'all can reach out to her via that avenue. Do you have any social media handles you want people to follow you on?
You could follow me on Instagram at Tranika. That's TranikAJ26. And if you want to see me serve all my looks and hairstyles, yeah, follow me there.
That's what's up. That's what's up. So I always like to end my interviews with Randy's random questions. So you ready?
I'm ready.
All right. So question number one, why do you have so many birthday celebrations?
Because I am a celebration. I feel like it shouldn't be one day out of the year that I should be celebrated. I feel like every time I walk out the house, it's a celebration. Every morning that I wake up, that was not promised to me, it should be celebrated. And I feel like I shouldn't have to subscribe to societal norms saying that my birthday was only on March 30th. How do I know my birthday was on March 30th? That's what man told me. I don't know that. So any day I pick or choose, it's my birthday.
You getting a cake every time you go out. so so many
Free cakes, yeah,
birthdays. Why was it important for you to go to an HBCU?
because I wanted the representation and the reflection of me. For one, I wanted to get out of Bryan, so I was like, I'm going to college. Number two, I was like, well, I want to get away from Bryan, but like I'm still scared and young, so I don't want to go too far.
Mm-hmm.
And then every morning when I was getting ready to go to high school, I would watch a different world. And so just going to the HBCU was like my only option. I was like, I'm going to a different world. I'm going to PV.
Mm-hmm.
It's gonna be just like different world when I watch that every morning. Um, I look like Whitley Gilbert and I act like her too. So it's like I'm gonna go to PD. I'm gonna find me what was Dwayne. I'm gonna get me Dwayne there. I'm gonna be
Mm-hmm.
AKA. So I didn't fulfill like my dreams. HPCU, AKA. I just don't have my Dwayne yet.
He's coming. He's coming. So, last question. This is a two-part question. It might be a hard one for you. You ready for it?
Yes.
Favorite Houston artist and favorite Houston song? Ah,
Um,
man, we made her scratch the back of her head on that question right there. She's like, so many choices.
it
Oh man, Slim
is.
Thug to Beyonce to doing the South Side to Tops Drop, Fat Pat. It's so many different options.
I'm gonna have to go with because I'm a little hood. Um, Big Mo,
Okay, okay.
and let me see what's my favorite. I think it's called Choppers.
Choppers. That's by Big Mo.
I think so.
Ooh, I'm gonna have to look that
Let's
up.
see.
I'm sure there's probably a YouTube video with it screwed and chopped with only like 2,000 views, and you probably did 1,000 of them. I'm gonna have to go
Right,
find it.
because I'm a fan.
Yeah. Oh man, RIP Big Mo. But we let you off the hot seat. I appreciate you being on the podcast, sharing a lot of information, especially for Autism Awareness Month. Y'all make sure to go follow her on her social media channels. Hit her up as far as email so you can get more information about her practices, especially if you want your child being seen.
Thank you so much for having me.